we are noticing a change or a shift in our surveillance and incidence of cancers. Um, Over the last decade or so, we recognize that the incidence of cancers are increasing almost yearly. When you look at it on a whole, the numbers of cancers now are more than we've ever had before. There are times when we've had decreases, and drilling down a little closer from 2012 to 2015, we saw a slight decline in some of the cancers or the majority of cancers. But unfortunately, we're beginning to see another rise over the last 2 years or so. Granted that the total numbers now are higher than it was before. So that's the trend we're seeing as it relates to cancers totally on the island. The gender distribution of cancers happens, and that's one of the things that are looked at and collected as epidemiological data. Worldwide, we notice an increase in cancers of colon cancers in female and rectal cancers in male. As to why that is, I am not quite sure. That is just how we have identified the epidemiology. And I think the picture is probably similar in developing states like Grenada as well. Whether there are predisposing factors to it, again, those are issues that can be looked at. There'll be multiple factors involved in this, but to say that I can pinpoint the exact reason why that is not exactly possible right now. Contributing factors to cancers totally, or risk factors to cancers as we call it, are multifactorial. There's a lot of reasons why that is. We know what the risks are. So for example, it was clearly seen through epidemiological studies that diets that are rich in fats, for example, or the westernized type of diets are associated with persons having more cancers. And so persons who eat local foods or eat natural tends to be more protective from cancers. So yes, that has been there on one end. And then of course, exposure to other things, exposure to radiation, for example. There are so many things around us that emits this kind of radiations that can be very dangerous for us. We have cell phones all over the place. We have ultrasound, microwaves, even excessive radiation from the sun and exposure to ultraviolet radiation. So fishermen and people with lighter skin also have a tendency to at increased risk. Persons who smoke a lot can also have increased risk. Persons who drink lots of alcohol, increased risk. And then we also noticed that for the younger men, exposure to human papillomavirus or HPV increases the chances of both cervical cancers in women and throat cancers, mouth and throat cancers in male population. Because most of the times, by the time you see symptoms of a cancer, it's already too late. So my usual answer is there aren't any symptoms associated with early cancers. Early cancers are people walking around normal. You feel okay, nothing is wrong with you. Cancers could be forming right there. The point is you have to check early.